The day of being a plastic surgeon where we're just a surgeon is over. To be successful, because everything's more non-invasive. It's more about aesthetic medicine than it is about plastic surgery. It's cosmetic medicine. It's thinking about the whole process, because so much of what we do is about that. It's non-surgical options, whether it be Botox or fillers, fat grafting to a certain degree, skincare products, diet, exercise, all of those are part of aesthetic medicine. Plastic surgery has to be comprehensive today. And so within my own practice, we have sort of a spa, which is simple things like massage, facials, manicure, pedicures. We have a medical spa, which has a lot of the non-invasive procedures, lasers and fillers and Botox, skincare, which is very, very important. For the patients that need it, we have a diet program, a nutritionist, you want to help them get on an exercise program. You can have life coaches. There's a lot of things you can bring into the puzzle. And then lastly, it's to get to surgery, because sometimes all of those things aren't enough. Maybe they need a mommy makeover. All the exercise in the world isn't necessarily going to make the belly flat. So we have surgery for those patients who need surgery. But we don't want to forget about the whole patient. And I think if you do aesthetic medicine that way, then I think you're going to provide a service to your clients, and not just doing surgery and sending them on their way, but being with them, sort of being the last primary care practitioner with your patient. And so I think as plastic surgeons, we have to provide all of that if we want to completely take care of our patients. It's a new paradigm in how we as plastic surgeons need to deal with our patients in a much more complete way.